All right, future nurses, let's get started. I'm here to walk you through a clinical deep dive on respiratory infections. We're going to cover the things you'll see every day on the floor, and the stuff that's definitely going to pop up on your exams. Think of this as your practical guide to patient management. Ready? Let's jump in. So picture this. Your patient walks in and they've got this classic trio of symptoms. Now, it could just be a simple bug, right? Or it could be the first sign of something much more serious. Your job, your absolute core skill, is knowing how to tell the difference. It's all about that initial assessment and figuring out the right plan of attack from the get-go. We're going to start our journey right at the top with the upper respiratory tract. And first up is the one complaint you are going to hear over and over and over again: the runny nose, or as we call it, rhinitis. But as you're about to see, not all sniffles are created equal. Okay, so this is our first big decision point, and it's a crucial one. Are we dealing with an allergy or an infection? On the left, you've got allergic rhinitis, which is all about environmental triggers. But on the right, you have viral rhinitis. Yep, the good old common cold, caused by this whole family of viruses. Now here's a key point for your exams. Immunity is virus-specific. Catching a rhinovirus gives you zero protection from, say, an adenovirus. And that's exactly why your patients get colds again and again. This is the classic picture your patient's going to describe. Now, for a straightforward viral cold, your role really shifts from treater to teacher. You're going to coach them on getting plenty of rest. You'll tell them to push fluids, and I mean at least 2 to 3 liters a day, because that helps thin out all that mucus. And for the aches and the headache, NSAIDs are perfectly fine. This self-care is really the main treatment here. Now lean in for this one, because I can almost guarantee you'll see this on an exam. The nasal discharge itself gives you a huge clue. If it's watery and clear, your brain should be screaming viral. But if that cold drags on and the discharge turns purulent, thick, yellow, or green, that's a major red flag. It tells you a secondary bacterial infection has likely jumped into the mix. And just when you think you've got it figured out, here comes a curveball. What if it's not an allergy and it's not a germ? You always have to check that medication list. Why? Because some common drugs, like certain antihypertensives and even oral contraceptives, can cause rhinitis as a side effect. So remember, a good medication history can solve the mystery before you even think about ordering a test. So let's just quickly recap your patient education playbook for the common cold. First, fluids, 2 to 3 liters a day. Second, rest is not optional, it's essential for recovery. Third, teach them proper hand washing. This is how we break that chain of infection and stop it from spreading. And finally, advise them on the right over-the-counter meds to manage their symptoms. This is core nursing right here. All right, so we've handled the common cold. But what happens when that simple infection decides to get a little more serious and settle in somewhere specific? Now we're moving beyond the common cold into conditions like sinusitis and pharyngitis. This image perfectly illustrates what happens. A cold hangs around, the nasal passages get swollen, and the sinuses can't drain. What you get is a perfect, warm, moist breeding ground for bacteria. And boom, your patient now has acute sinusitis, which is a whole different ballgame. So how do you spot it? Well, the symptoms are pretty specific. They're not just congested anymore. They have facial pain, maybe a headache that feels like pressure. You'll see that purulent discharge we talked about, often a fever, and they'll be tender if you press over their sinuses. The culprits are usually bacteria like Strep pneumo or H. flu. Recognizing this pattern is what gets your patient the antibiotics they actually need. Okay, let's switch gears to another super common complaint: acute pharyngitis. We're talking about a sore throat. But for us, a sore throat is a mystery to be solved, because we have to figure out if we're dealing with a simple virus or the more dangerous bacterial infection known as strep throat. Now, if that throat culture comes back positive for group A strep, your nursing priorities become crystal clear. And number one, with a bullet, is medication adherence. You have to drill it into your patient and their family. You must finish every single antibiotic pill. Why? Because if they don't, that bacteria can cause devastating complications down the road, like nephritis, which damages the kidneys, or rheumatic fever, which can destroy their heart valves for life. This is non-negotiable. Sometimes, those throat infections just keep coming back, leading to chronic tonsillitis. When that happens, or if the tonsils get so swollen they obstruct breathing, surgery might be the answer. A tonsillectomy is a common procedure, but your role in post-operative care is absolutely critical to keeping that patient safe. This is your post-op playbook, and you need to know it cold. Number one priority is monitoring for hemorrhage, and the most subtle sign, the one you have to watch for, is frequent swallowing.
That could mean they're swallowing blood. Any sign of bright red blood is an emergency. You'll also keep them positioned to allow for drainage and use an ice collar for pain. Your vigilance here is what prevents a routine surgery from becoming a disaster.
So, we've walked through everything from a simple runny nose to a post-surgical bleed. How do we pull all of this together into a framework we can use every day? Let's synthesize this into a clear, high-level playbook that you can apply to any of these upper respiratory conditions.
This is your 4-part framework. It's simple, but it's powerful. First, you assess. Is it an allergy, a virus, or bacteria? Get to the root cause. Second, you educate. Teach everything from hand washing to why finishing that antibiotic prescription is so important. Third, you manage. This is about symptom relief and making sure that medication plan is followed. And fourth, you monitor. You are the eyes and ears, always watching for those red flags, those signs of complications like a post-op bleed. That right there is excellent nursing care.
And we're going to end with this question, because this is really the whole point. This is why all of this matters so much. Your ability to tell the difference, to educate your patient, to spot those danger signs, it isn't just about passing an exam. It's about protecting your patients from real, preventable harm. It's about being the nurse that they are counting on. Now go study well.